Themes in therapy, Toig. What would be like common themes that you'd find in therapy, the clients that come into you?
So I'd say the, probably the two most common themes that I talk about are work stuff, something in the orbit of the professional world, and uh, relationship stuff. So romantic relationship, but also it could be a family relationship. So those kind of, for me at least, those are the two most common themes that I talk about in therapy. It would be something to do with work or something to do with how the client relates to another person, and generally that's their partner, but it could be a friend or their family somehow. Those are the two big things that I would talk about in therapy.
Or work colleagues,
Work
maybe. Yeah,
colleagues, all that
yeah.
sort of stuff. I'd say I spend maybe like 40% of the time, something like that, talking about those two areas. Outside of that, it can be self-care, like how people are looking after themselves can be a big issue as well, and that could be like lifestyle, how people are living, how they're treating themselves. So those would be three big picture themes that I seem to talk a lot about in therapy. Work related stuff, and that could be like just someone who hasn't professionalized, doesn't have any professional identity at all, and are trying to build a roadmap how to get their kind of career together, or
Yeah.
like maybe they're living at home and they're getting kind of on their 20s and they're not happy about that, and that kind of professional thing. Or it could be, if we're talking about romance, it could be the fact that they don't have a romantic relationship, and it could have themes to do with loneliness.
Yeah, that's a good point. Yeah. Yeah.
And the self-care piece, it could, like our lifestyle, it could be just about reflecting on how they're living, and where their life is going and what they're doing with their time. So those three big things I would talk about. Any other common themes, Lawrence?
I suppose what comes to mind with the themes would be, I think clients might come in and be they would be have awareness around it's a relationship issue and it's to do with work or it's personal life. But when it comes to the self-care stuff, I don't think clients come in and are overly aware of the self-care
Yeah,
side of things. It's more the therapist, I find, will need to kind of help them identify, areas around self-care and
yeah,
what that
yeah,
means and what that looks like for them. Because not everybody will be too kind of clued in around that type of language around self-care, but they could be doing lots of things that represent self-care, um but common themes, yeah, as you were mentioning, work and professional life and relationships, professional and personal. I was thinking, oh, they're exactly the two main themes that come up in sessions all the time. It's something to do with work life or something to do with personal life, And I know they're very broad
yeah,
areas, and but yeah, they're usually like the common larger themes that are spoken about, and usually then it's around relationships with other people and also relationships with self.
yourself.
Yeah, with
Yeah, very
yourself.
good
Yeah,
point. Yeah,
yeah, and that would then link in with self-care,
yeah,
your relationship with yourself. So yeah, yeah, I'd agree. Work life and personal life are the most common
yeah.
themes. Yeah.
And your relationship with yourself, how you feel about yourself, kind of self-esteem,
Hmm.
um, and those things, like they're a Venn diagram. They're like a three-dimensional Venn. Like they all kind of intersect with each other.
Oh yeah,
They're
yeah,
not isolated.
yeah.
So
Mm.
they can't like so. But from time to time, you will get something more specific. But generally, like, let's say you had a client who was exhibiting some OCD behavior. Now, it's possible that that OCD behavior might be like a low level OCD behavior that's related to stress, and it could be like a way of acting out. If someone's quite stressed out, or maybe like addiction, for example, let's say someone's very stressed out, and when they're very stressed out, they might drink more. So as I'm not an addiction specialist, so I can handle something like that, and that's absolutely fine. And we'll look at like self care, or maybe the stress in work, and we'll reduce the stress in work, or stress, and we can reduce the stress and anxiety in your personal life. And as a consequence of all those self care pieces coming together, the the acting out addictive kind of behavior comes down. But there will be some people that aspect is huge. Like it's a really big struggle for them. OCD type behaviors, or maybe addiction based behaviors, or it could be like anger behaviors, and they get really, really big, and it could potentially get too big for me to handle, and then we might need somebody who really specializes in that area. So sometimes people come in with a very, very, very specific thing, and it's like, I need to work on this. And with that person, those specific themes, like, could be OCD behavior, addiction behavior, anger kind of behaviors, those type of things. Those are also common themes. At a low level, your average therapist is fine to kind of work with that stuff. But if that aspect or that theme is it takes up a huge part of that person's life, you might need to refer on to someone who specializes in that area. But those are common themes that I've come across about addiction, anger,
yeah. What comes to mind for me around the kind of supports, like if it's referring a client to somebody who's more specialized in addiction or anger management, is sometimes you could continue seeing the client that recommend external supports that work in parallel with the therapy. For instance, like if someone has an issue with alcohol, they might join AA, or someone has an issue with anger, they might go and do a course to educate themselves on anger and how to manage their anger, just to kind of educate themselves, so they're not just relying on the therapy as a solution to the problem. They're going to therapy, they're also going to support group of some sort, so they're tackling it from a couple of different angles.
So like the most common theme in therapy, is help. Like, people want help, and so your job is to try and help them. And often the best help you can give someone is to point them in the right direction. So just people just want some help.
The most common theme would be people looking for help around an issue or issues that they're having. And the therapist and the client working collaboratively to find supports and solutions for that problem, know.
And it's not necessarily always with doing some kind of deep work. It could be very, very practical stuff about, like, here is a list of places that would give you support in that area. And the therapist having a good idea of what supports are out there. So to summarize, I think most common themes: work stuff, relationship stuff, whether it's romantic or professional, or platonic, or some sort of family relationship stuff. People reflecting on their lives and where they're going, that's kind of a big issue. You do have more specific issues that come up that are quite common, like things to do with addiction or kind of acting out in some way, whether it might be OCD type things or anger. And then just the general big picture thing is people come looking for help. They're like, hey, can you help me with this thing that has to do with my life? So those are the common themes. There's loads more we could mention, but those are the big ones that we work with on a day-to-day.
Okay.
Cheers.
Good. Okay.
Coffee.
Done.
Okay.
Now for 20 past. Good stuff. Everything